Well, time for The Exchange, where we take a look at the importance of global vaccine equality. Joining me now is Dr. John Nkengasong, Director of the African CDC. He joins me now live from Addis Ababa in Ethiopia. Good to have you with us.
Thank you.
Doctor, as has been discussed plenty of times on this program, Africa has virtually been left in the dust when it comes to a global scramble for vaccines. And of course, those in the poorest countries are dangerously protected. But we are now seeing some supplies arrive. As I just mentioned, we're seeing some from the US arriving in Nigeria. Some 4 million doses of the Moderna just arrived, and another 29 million doses of Johnson & Johnson expected later this month. So there is some progress, albeit slow.
Absolutely. I think let us start with the very good news. I mean, that in the next days, starting actually tomorrow, the distribution of the 400 million doses of the Johnson & Johnson vaccines that were acquired by the African Vaccine Acquisition Task Team, called AVAT, will start flowing into the continent. I think that is remarkable that Africans themselves have been able to mobilize, paid for by their own taxpayers' money, up to 400 million doses of vaccines. I think that is very good news. And if we complement that with what we are seeing from the US donations and others, I think it begins to give us hope that in the coming months, we can begin to scale up vaccination in a predictable manner.
It really is, as you say, some promising news, given that for many weeks now we've been discussing that COVAX, which is the global program to deliver vaccines to poorer nations, is about 500 million doses short of its goal. But even where it has been delivered, there has been problems with distribution. And I'm thinking of places like Chad, like Benin, that have reportedly had doses sitting in country that have expired before they've been administered into people's arms. What do you make of cases like that and those issues with distribution?
I think that there are two things we should remember: that it is there's an urgent need to acquire vaccines and in a predictable manner. That way, countries can plan for the in-country distribution. If you suddenly ship vaccines to a country and they were not ready to distribute those vaccines, it becomes challenging. Then you end up with those vaccines that will be expiring. The second thing is that we should make sure that vaccines that are shipped to the continent of Africa have an appropriate expiring date. It has come to our attention that some vaccines are shipped and they have just an expiring date of 3 weeks. That is not appropriate. I think that will not help us solve the problem of vaccine inequity. So I think we should really look at it in a holistic way. Countries have been vaccinating over the years. In the middle of this crisis, Ethiopia was able to vaccinate 12 million children with measles vaccine. So that tells us that if the vaccines are available and in a predictable manner, countries can plan and effectively design programs to roll them out appropriately.
So you're saying that some of those vaccines that arrived were very close to their expiry date. The other issue being communication, to make sure that there is that distribution, that there are medical staff available ready to administer them. What can be done to improve that problem?
I think the simple thing to do is to coordinate. I mean, coordinate that with the African Union, coordinate that with the African Vaccine Acquisition Task Team that is coordinated by Strive Masiwa. And this is an initiative that was put in place by President Cyril Ramaphosa, who is the COVID champion for Africa. So we have the instruments available on the continent that cover all 55 member states of the African Union. But what is surprising to us at times is where countries that are donating the vaccines do not take advantage of that coordinating mechanism to roll out the vaccinations in countries. And that will continue to be a challenge except we address that issue.
And to tackle this pandemic, it does need a global solution. If you have unvaccinated people anywhere, whether it's because people are reluctant to get it or because of poverty, they don't have access to it, it does allow the virus to continue to mutate. And as we have seen in this most recent variant, the Delta variant, it is far more transmissible. Talk to us about the other concerns with regards to logistics, because it's not just the distribution point of contact. There's also issues around freezers and generators to store some of these vaccines, especially if they do have a longer expiry date, right?
Absolutely. That's what I meant by having a predictable source and arrival of vaccines on the country. Say, for example, if you were to ship Pfizer vaccines to Ethiopia, where I'm based, the country needs to be ready with the deep freezers, the -80s, and the ultra cold chain that is required. It is a very different requirement if you ship the Johnson & Johnson vaccines or the AstraZeneca vaccines that require a simple refrigeration. That is what I mean by having a better understanding and a predictable supply of the vaccines. That will enable us to prepare appropriately.
And in terms of testing throughout the continent, while it has been difficult to conduct a thorough testing to get an accurate picture of data and to demonstrate how rampant COVID-19 is, where we are looking at specific cities, I'm thinking of places like Dhaka and the capital of Senegal, we are hearing from doctors that are saying that their hospitals are overwhelmed. This is a city of 3 million people. Which areas are you hearing that are much worse than what we're seeing in terms of the data that's coming in?
I think overall, as a continent, we are going through a very severe third wave. About 31 countries are actually going through a very serious third wave. And we see that the peak of this third wave is significantly higher than the peak of the second wave. And of course, the second wave was higher, the peak was higher than that of the first wave. So because of that, it lends itself naturally to an overwhelmed health system where hospitals are full, nurses or healthcare providers are in short supply. So it is not a surprise that the situation that you described in Senegal will be true across many countries in Africa. That is where it is very important to scale up our testing, take advantage of the rapid technology that we have in terms of antigen tests to scale up testing so that we can flush out and find the hotspots that are available and do something with it in terms of isolating people that are infected.
All right, Dr. John Nkengasong, Director of Africa's CDC. Good to get perspective from you. Thanks so much for your time.